Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, diagnosis of a case with meningitis. So, how are you going to diagnose meningitis? So, first and foremost, for the diagnosis of meningitis, we do a head CT scan is done for the diagnosis of meningitis. This head CT scan is actually done. When do you do this head CT scan? This head CT scan is done before we do lumbar puncture. It is done before lumbar puncture. Right. What do you see in the head CT scan? In the head CT scan, we will see whether the intracranial pressure is raised or normal. So, if intracranial pressure is found to be raised, then in such cases, we give the patient mannitol mainly to decrease the intracranial pressure. Because lumbar puncture is never done with raised intracranial pressure. In raised intracranial pressure, lumbar puncture is not advisable. So, if there is raised intracranial pressure, we give mannitol to mainly decrease the intracranial pressure. And this head CT scan is also done to confirm the presence of meningitis. Then, CSF analysis is actually the gold standard and the most important for diagnosis, which we see next.
thank you and thank you for watching.